60% of the population have a thyroid issue and don't even know it. 1 in 8 women have a thyroid issue. The number one root cause of hypothyroidism is Hashimoto's. Your weight gain, your fatigue, your insomnia, dry hair, brittle nails, dry mouth, constipation, IBS label, early perimenopause from your thyroid. In this video, I'll explain to you how to fix your thyroid through the root cause approach, like I do with every single one of my clients inside the Complete Vitality Functional Health Coaching Program. My name is Diego Reyes, functional medicine practitioner, clinical nutritionist, personal trainer, health coach, owner of Complete Vitality. So in this video, we're going to go all over thyroid function. We're going to go through the anatomy, physiology, but why you don't feel well. We're going to talk about that today. Disclaimer, the materials will be used from another resource, and that will be found in the description below this video. Now, so what we want to talk about today is your thyroid, okay, right here. Now, I'm not going to get into anatomy, physiology. We aren't in endocrinology class. But understand, this little thing right here produces hormones that works on every single cell inside your body. It works on your temperature, your body temperature. It works on digestion. It works on fertility. It works on methylation. It works on nutrient status. It works on your metabolism. So what happens if there's something wrong with your thyroid? It has a profound effect on your body. And this is never talked about. Has your endocrinologist ever talked about that your constipation could be linked to your thyroid issues? Has your endocrinologist ever told you that your hair loss is linked to that? Well, what they would tell you is to go see a GI doctor, a gastroenterologist, go see a dermatologist. Let's talk about some terms here. So what happens here? And this is going to get a little high level, so if you love this knowledge and you like learning, then this is going to be great. And if you don't, then I would just skip towards a different part of the video. So what happens is your hypothalamus in your brain releases something called TRH. I just simplify it. It's called thyrotropin releasing hormone. This is produced from the hypothalamus to release to TSH in the pituitary gland, which is also in your brain. A lot of people know TSH because it is what's typically tested in the model of thyroid care. But as you know, it only tells one fraction of what's going on, okay? It only tells one fraction. I'm going to have to get some water because this is like the 6th video today. So the next is going to be T4. So T4, so what's happening? Your pituitary releases TSH to your thyroid. Now we're actually at the thyroid gland. It releases mainly T4, okay? And a little bit of T3 goes into your thyroid hormone, T3. So what happens then? A conversion needs to happen. That T4 has to convert into T3, okay? And then you have reverse T3. So this is the extra hormone that doesn't get used, gets shot back out because it is one big called negative feedback loop, okay? It's a negative feedback loop, and your body perhaps is a negative feedback loop, okay? All right, so let's get into the next one. All right, bear with me because I know this is going to be hard to read, but I want to talk about something real quick. So you have brain fog, you have fatigue, you have insomnia. Your doctor said your labs are normal, but you don't feel normal. It's because they're not testing a full thyroid panel. They're literally testing a TSH, thyroid stimulating hormone. We talked about that. Remember, your TSH is not even a part of your thyroid. It's released from your pituitary gland. They maybe test T4, rarely. But what's going on? We're missing all these pictures. They're not testing T3. They're not testing total T3. They're not testing free T3. They're not testing total T4 or even free T4. They're not testing reverse T3. And they're not testing a TPO antibody. This is thyroid peroxidase autoantibody. They are not testing this. Now, this is so important to understand. I cannot tell you enough. Because if you are dealing with an elevated TSH or your doctor said that you have hypothyroidism, you need to check your antibodies because you could be dealing with Hashimoto's. And you never know this because they never test a TPO thyroid antibody. When that is elevated, I see it all the time in my practice. When that is elevated, that signals an autoimmune attack, immune system attack to your thyroid. That then will lead you with a plethora of issues. Now, the only solution they have for a hypothyroidism or Hashimoto's, and this is actually why they do not test these levels, is because they're going to give you synthetic T4. Okay, I'll say that once more. If you have hypothyroidism or you have Hashimoto's, the only solution they're going to give you is synthetic T4 hormone. This is levothyroxine or Synthroid medication. This is why the allopathic medicine model will not test your thyroid antibodies, because even if it was off, the same solution will be there, such as just give the patient T4, just give you T4. And it's astonishing because when you actually look at the bigger picture, if you are dealing with Hashimoto's, it has nothing to do with your thyroid gland. It is just the culprit. It is what's getting attacked, but it doesn't fix why the immune system is going haywire and causing this autoimmune attack to your thyroid gland. Okay, this is important. And this is, if you know a loved one, and if you're dealing with this, and you are dealing with hypothyroidism for like 10 years, 15 years, and your doctor keeps upping the dose of Synthroid or levothyroxine, and you're not getting better, then you got to get a TPO antibody checked. You got to get your Hashimoto's. You got to, and even if you do have no Hashimoto's elevated through a TPO reading, you got to get a thyroid ultrasound done as well. You got to get this done. I cannot stress it enough. I'm not going to sit here and have you suffer. It doesn't even have to be through me. Go talk to your doctor today. Get a TPO antibody. Go call your endocrinologist. Because if you have any of these issues, brain fog, fatigue, insomnia, depression, anxiety, you deal with any of these, that could not just be hypothyroidism. That could also be Hashimoto's. Now, I will not forget you on the other side, Graves and hyperthyroidism, because that absolutely is terrible. That is terrible. Heart palpitations, anxiety, can't sleep, losing a bunch of weight, which I know some of us wish we had to, but no. So, now, I want to talk about what's actually listed on the sheet now. Reference ranges, okay? Now, this is another issue. When you go get your labs done with your doctor, they're not looking at an optimal lab value. They're looking at a sick population. And actually, each year, it's getting worse. It's getting worse as time goes. I can't believe it. It's super sad. So, typically, as a functional health provider or whatever, so I like looking at TSH from 1 to 2, okay? So I like looking at 1 to 2. That's where I like TSH, okay? And I like free T3. Now, free T3, I like a little bit, like 3.2, it's good. Above 3 always. I always like it above 3. Now, I'm not going to get too much into this because you might not even know what the heck this means, so it's all good. Going back to what I just hounded on. TPO antibodies. You want those below 60. Now, if it's in your 30s, if you're like in the 30s, it also will show up depending on the lab test you're using. So if I usually use LabCorp, Quest Diagnostics, doesn't matter. If it's above 30 in a LabCorp, then it's going to be signaling an autoimmune activity. So another big one, iodine. It tests iodine. You have to test iodine. Here's why. Your T4 and T3, those are iodine atoms. And so what happens is when T4 converts into T3, it cleaves an iodine. It's called iodine cleaving. If you're in the Midwest too, the soil here, I say here because I'm in Minnesota, it's worse. So it's more devoided of iodine. So like me specifically, I use iodine salt every day, which you remember when they fearmongered that? So anyway, and if you're taking too much iodine, that's going to cause a goiter. So your thyroid gland is going to be enlarged. And it's funny too, because if you also have an iodine deficiency, it can also cause that. That's why you got to test and not guess. Okay, let's look at some notes on thyroid. So mild subclinical hypothyroidism, definition, is a high TSH with a normal T4. This is really critical, guys. Why is it really critical? Because if you have subclinical hypothyroidism, it's just like normal hypothyroidism, but the only solution they give you is T4 medication. And as you can see through the definition right here, You have normal T4. Your T4 is fine. Why are we giving you thyroid like, why? You know why though? It's because they want that T4 medication to convert into T3. But here's the issue. It's a conversion issue. The T4 to T3 conversion is impaired. It is impaired due to many factors that I'm about to get into. But this is important. Okay, classical overactivity, hypothyroidism definition, high TSH, suboptimal free T4. Majority of 99% of T4 in the blood is bound to thyroxine binding globulin. That's going to be something I'll get into. Measures by how much unbound T4 is in the blood. Okay, so what you're seeing here is that some people do not feel well on thyroid medication because it doesn't even fix the issue that's going on, because some people have normal T4 levels. They have normal T4. So they're over here giving someone T4 medication when their T4 is fine. I'm going to give you some iron even though your iron is fine. You know what that can cause? That can cause a multitude of issues. Talking about systemic effects to having a poor thyroid function, okay? When your thyroid levels are low, now here's the thing, if you're watching this video and you're having any of these symptoms, then check your thyroid. By the way, I check people's thyroid at CompleteVitalityLife.com. You can also message me at 507-508-8831. I'm hoping I'm bringing some passion here today because it's a very passionate topic. So, bone health, osteoporosis. You know, I used to work in a nursing home, and I would see, it's like as soon as someone falls, it's over. That's scary stuff. And it just could be linked to a thyroid deficiency. Okay, gut health. Now this is a sleeper. Low thyroid function slows the intestinal motility and compromises your ability to absorb nutrients. When you have low thyroid health, you can't absorb and move food throughout your digestive system. When thyroid function is working optimally, it actually dampens gut inflammation. Oh, there you go. Oh, I guess a hormone that God made you improves many dysfunctions that could happen in your body. That's a shocker. When there is low thyroid function, you might see gastric ulcers, leaky gut, etc. All right, this is frowned upon functional medicine, functional medicine. So what is that saying? It's saying that if you're dealing with chronic acid reflux, heartburn, indigestion, it all could be coming from low thyroid function. Here's one that sucks. Libido tanked. No desire for sex. Why is that? Thyroid hormone affects the metabolism of estrogen and testosterone in the body. So guys, testosterone you need thyroid hormone, and especially females, which I always hound on the females I coach because they always have low libido, but it's funny because I always test their testosterone. It's always low. So, and again, I actually test their thyroid too. It's low as well. So there's a reason. Weight. Here's one. I'm sure everyone has this. You know, low thyroid hormone slows the body's ability to break down fat. Lipolysis, the burning of fat. Your T3 hormone, your thyroid hormone, works on every cell inside your body. Okay? Your thyroid hormone, T3. All right, T3, the main thyroid hormone, the active thyroid hormone, works on all cells in your body. So if you're dealing with any low T3 level, you're going to be dealing with slow metabolism. Also something called mitochondrial dysfunction. That's a whole topic. Energy, blood sugar. Low thyroid hormone decreases the body's ability to absorb glucose. When glucose can't get into the cells to perform its physiological function to create energy, the result is hypoglycemic. Low blood sugar, even if blood sugar's labs look normal, the sugar isn't getting into the cell. Now, if you really want to learn about thyroid health, look at the book Thyroid Debacle. But let's get back to it. So low lipid levels. Low levels decrease the breakdown of cholesterol. Now, this is so critical. Because what is the number one killer in the United States right now? It is cardiovascular disease, cardiometabolic issues. Low levels of thyroid hormone will decrease the breakdown of cholesterol. What is the most terrible medications and one of the most prescribed medications in the United States? Statin drugs, statin medication that suppresses cortisol function. Your brain is made out of cholesterol. Your hormones, that is the precursor to your hormones. Cholesterol is. And your low thyroid function could be the root cause to that. Has anyone ever said that? Adrenal exhaustion, adrenal fatigue. After 8 cups of coffee, after 8 hours of sleep, I still can't wake up during the day. It is a thyroid issue 100%. Okay. Toxic overload. Your liver and gallbladder don't have the energy, because remember we talked about T3 is on every cells, to remove the toxins, digest and break down dioxins, toxins, phthalates, mycotoxins, mold spores. Your body is one unique biology that God gave you, and everything is needed for a reason. Okay, estrogen dominance. But I'm not even going to get brain cognitive issues, hair loss, temperature dysregulation. I mean, the list goes on and on. Your thyroid and having low thyroid hormone or even having Hashimoto's will affect all these things. That's why you got to test and not guess and get to the root cause of your issues. Hypothyroidism. Hypothyroidism is a condition where the thyroid is underactive and not producing adequate amounts of thyroid hormone. All right, it's in the name, hypo. So, all right, over 12% of the U.S. population will develop a thyroid condition. Once more, 12%, over 12% of the U.S. population will develop a thyroid condition. Up to 60% of those with thyroid disease are unaware of their condition. Your doctor never tested this. Your endocrinologist, your concierge clinic started pumping you with sex hormones, never looked at your thyroid hormone. That's like your estrogen, testosterone, and progesterone, by the way. All right, hypothyroidism is the second most common endocrine disorder affecting women of reproductive age. You know what the first one is? It's PCOS, polycystic ovarian syndrome. All right, look at this. Hypothyroidism is the second most common endocrine disrupting disorder. I mean, the most common cause of hypothyroidism in the U.S. is Hashimoto's, which is 5 to 10 times more likely in women than men. Okay, so if you don't feel well and you haven't checked your thyroid by now, and by the way, I have thyroid testing that you could just get testing through me. Like, you could just get the test through me. You don't have to get coached by me. You don't have to use my clinic. You don't have to use anything. You can just take care of yourself and your family. Get the thyroid. Most common cause of hypothyroidism in the U.S. is Hashimoto's thyroiditis, which is 5 to 10 times more likely. I already got into this. 1 in 8 women will experience a thyroid issue in their lifetime. Weight gain, fatigue, slower heart rate, elevated blood cholesterol. We talked about that one. Mood changes, depression, memory issues, brain fog, enlarged thyroid gland, something called goiter. All right, constipation, joint pain and stiffness, dry skin and hair, hoarse voice, cold hands and feet. All hypothyroid symptoms, but yet my labs are normal. No, they're not. You never tested all of your thyroid issues. Promise you that. So why is thyroid function low? Okay, so my thyroid is, I mean, I got all these symptoms. It's going to mess up my health in many issues, many ways. So what is the root cause? You know, we talk about root cause in functional medicine, okay? Functional medicine is looking at the body holistically and how all the systems work together to create a function, and that function is how you feel, okay? So stress and inflammation. All right, when your body is stressed, it can impair thyroid function, okay? Because it can block the conversion of T4 into T3. Okay, a natural biochemical process, or I should say thing, that your body does, stress and inflammation block it. Food intolerances, that can cause inflammation, especially in autoimmune, so having Hashimoto's can trigger over activity of the immune system. All right, here's the next one. All right, so I'm going to give you something called clinical observation. That means what do I see actually working with real humans every single day? Poor gut health, stress and inflammation. These two, the main root cause, the main issues to why your thyroid's close to 80% of your immune system is housed in the gut. We talked about this, we know this. About 20% of T4 is converted into T3 in the gut. So an imbalanced, unhealthy microbiome will affect this process. infections, bacterial, parasitic, fungus, yeast can all trigger Hashimoto's. Okay, when you have low T3, that could be a conversion issue. What will fix that? Fixing your gut health. Okay, if you have a bacterial, parasitic, fungus, yeast infection, that all can be triggered, or I should say that all can cause your thyroid to go haywire because it's pissing off your immune system, that then now the Hashimoto's is triggered. And we know that the Hashimoto's is triggered because your TPO antibodies are elevated. This is not profound, people. Okay. I hope you care as much as I do. So nutrient insufficiency or excess, inadequate iodine, selenium, zinc, iron, and vitamin A can all impair thyroid function. While excess fluoride and iodine can damage thyroid cells, okay, it's a Goldilocks effect with iodine, okay? Because if you don't have enough iodine, then you got hypothyroidism, and then if you have too much iodine, then you have a goiter in your thyroid gland. All right. Remember though, we talk about it. What happens is that you can't even digest and assimilate your food. So now you're deficient in vitamins. So now your thyroid takes a hit. Now you don't have sex drive. Okay, so what's happening? Well, I'm scratching my head here. And what's happening is that for a female, birth control, SSRIs, joint pain medication. No, your physiology's all screwed up. We can fix that. We can fix that. But so if you're dealing with thyroid issues and you relate to any of this content, this stuff right here that I just went through, then you can always message me, okay? CompleteVitalityLife.com, Diego Reyes Health on Instagram, Complete Vitality Life on Instagram as well. You can message me privately on my phone number, my personal phone number. That's 507-508-8831. I will fix your issues, guaranteed. I'll fix your issues. Just comment thyroid down below this video too. I'll reach out to you personally. Thank you for your time, and God bless you.